Hello guys, I hope you're well. Today we're going through gout, and specifically in gout, allopurinol. Now, a crucial point in the Gphc exam is the fact that musculoskeletal is now a medium weighted topic. So in gout, we have medication that's used for prophylaxis and medication that's used for acute attack and long term. That's a very, very crucial point. So as with a lot of chronic medications, diseases or chronic conditions, the medications you give is given as a low dose first. And generally, most medication, when you initiate a patient, you would give a low dose like Allopurinol. So this is very, very important. So use a reduced dose in elderly people or people with hepatic impairment. So this is very, very important. So do not prescribe allopurinol to people that have a known HLA-B allele. Now, why? Because they have more hypersensitivity. It's a bit like carbamazepine. So with carbamazepine, for some Han Chinese or Thai ethnic groups, you have to be careful and you have to screen them. And as the presence of the allele is known to be higher in these ethnic groups, and this applies to carbamazepine and allopurinol, by the way. So prescribe allopurinol of caution to those that have thyroid disorders and hepatic impairment, as well as renal impairment. So some common ADRs are rash. So advise people who experience a rash to stop allopurinol immediately and seek prompt medical advice. Now, why, guys? Because it could be a sign of SJS or toxic epidermal necrolysis, which is TEN. A rash can be the first sign of a rare hypersensitivity reaction. So let's pause here. So rashes indicate a hypersensitivity reaction. And as one of my viewers have said, some medications you need to do dose adjustments, even reducing dose by a quarter, by 25%. So if SGS or toxic epidermal necrolysis or a serious hypersensitivity reaction cannot be ruled out, allopurinol should not be reintroduced at any time, and that's a very, very important point. So this is a bit like angioedema, right? With certain medication, if angioedema reoccurs, then you would need to stop the medication because that's a problem. So angioedema is a non-allergic drug reaction. So other ADRs are gout flares. So advise a person who experiences acute attacks of gout after initiation of treatment of allopurinol or during established treatment to continue taking allopurinol. That's a very, very important point. Monitor white blood cell count before starting allopurinol. Azathioprine, so concurrent administration with allopurinol increases the hematological ADRs of azathioprine. So azathioprine and allopurinol can interact. Carbamazepine levels may be increased with concurrent use of allopurinol, and furosemide levels of an active metabolite of allopurinol may be increased with furosemide, and that is a very, very key point. Another important point is warfarin. So prothrombin time may be increased if taken concurrently with allopurinol. And thank you so much, guys.